Eligard, leuprolide acetate for injectable suspension, consists of an active drug, leuprolide acetate, in the atrogel delivery system, an innovative dual liquid polymer. Uniformly mixed biodegradable copolymers with even distribution of the active drug suspended within the carrier enables a consistent release of leuprolide acetate over time through an in situ delivered implant. A short safety needle is inserted through the skin at a 90-degree angle into the subcutaneous space. There are many sites with adequate subcutaneous tissue, and administration is simple and straightforward. Eligard is injected as a liquid, and it becomes a small pool as the needle is withdrawn. An exchange of the biocompatible liquid carrier within the atrogel delivery system and the subcutaneous aqueous fluids causes the polymer to rapidly solidify, capturing leuprolide acetate molecules in a solid, stable, biodegradable implant. The atrogel delivery system provides extended controlled drug delivery through optimized copolymer ratios that enable consistent degradation throughout the dosing period. 1, 3, 4, and 6-month formulations are available. Throughout the dosing period, Eligard slowly degrades, releasing leuprolide acetate into the subcutaneous tissue. As the atrogel delivery system's biodegradable polymers hydrolyze into lactic and glycolic acids, leuprolide acetate is released and enters the subcutaneous space, then enters the bloodstream. The acids are safely degraded into the byproducts carbon dioxide and water. Continuous and sustained drug release over a targeted time period results in persistence of drug at active concentrations throughout the entire dosing period. The active drug leuprolide acetate travels through the circulatory system until it reaches the pituitary gland, where its mechanism of action inhibits the release of luteinizing hormone normally produced by gonadotropic cells in the anterior pituitary gland. Luteinizing hormones act on Leydig cells in the testes to produce testosterone. Hence, Eligard prevents testosterone synthesis in the testes. Prostate cancer is the second most common cancer in men in the U.S. and is a testosterone-sensitive tumor. Suppressing testosterone production with Eligard can prevent the stimulation of prostate cancer cells to grow. Eligard is a GnRH agonist indicated for the palliative treatment of advanced prostate cancer. The atrogel delivery system delivers consistent, controlled, extended release of leuprolide acetate to suppress testosterone and inhibit the growth of prostate cancer cells. Important safety information. Eligard is indicated for the palliative treatment of advanced prostate cancer. Eligard is contraindicated in patients with hypersensitivity to GnRH, GnRH agonist analogs, or any of the components of Eligard. Anaphylactic reactions to synthetic GnRH or GnRH agonist analogs have been reported in the literature. Eligard is also contraindicated in women who are pregnant or may become pregnant. Expected hormonal changes that occur with Eligard treatment increase the risk for pregnancy loss and fetal harm when administered to a pregnant woman. Hyperglycemia and an increased risk of developing diabetes have been reported in men receiving GnRH analogs. Monitor blood glucose level and manage according to current clinical practice. Increased risk of myocardial infarction, sudden cardiac death, and stroke have also been reported with use of GnRH analogs in men. Monitor for cardiovascular disease and manage according to current clinical practice. Androgen deprivation therapy may prolong the QT-QTC interval. Consider risks and benefits. The most common injection site adverse events are transient burning and stinging, pain, bruising, and erythema. The most common systemic adverse events include mild to severe hot flashes, sweats, malaise and fatigue, weakness, myalgia, dizziness, clamminess, testicular atrophy, and gynecomastia. As with other GnRH agonists, other adverse reactions, including decreased bone density and rare cases of pituitary apoplexy, have been reported. See package insert for full prescribing and safety information.